most of the cancer research is funded by pharmaceutical agencies which have interest in them. So for example, for last year they looked at all the important cancer trials that came in medical journals, published medical journals, and they found that out of 53 important trials, only 11% could actually be reproduced. That is, they were true trials, because 89% of these trials are funded by the industry. So this is a little problem we have as doctors. So we have to decide very carefully what is true, what is published is always not true. So we have to decide. So this is a big problem with cancer. So then we come to the last area in biomedia is iatrogenic. This may be a small number, but actually if you look at actual numbers, it's not so small. In the United States last year, 80,000 patients died because of negligence in the hospital. I'm sure you can multiply it by 10 times in our country, or maybe 100 times also, because the actual statistics don't come out. There at least the statistics come out. Here nothing comes out, so we are not sure actually how, but it's significant percentage. The reason why this happens is not because of doctors' negligence as such, but I'll just show you how doctors' minds work, how we actually diagnose disease and how we proceed. So when a patient comes to us, we make a diagnosis based upon the symptoms that somebody tells us. We examine the patient and so on, and by the time we talk to the patients, 80% of the time we know what the disease is. And also it depends on the experience. When you're very young, it takes us a longer time. As you get older, it takes a shorter time to find out what the thing is, just based upon symptoms. Now when we investigate this further, examine and do other investigations, it increases the percentage to 84%. When we further do all the investigations, CT scan, PET scans, MR scans, everything, it increases the percentage to 92%. So this is how we make. So in 92% of the cases, we make a diagnosis by all this. In the rest of the patients, whatever we do, whatever tests we do, we can't make a diagnosis, and diagnosis is usually made at the postmortem if they go for postmortem, these patients. That is 6% we can't make a diagnosis. And in 2% of the people, we can't make a diagnosis even at the postmortem. So which means that there's a lot of uncertainties in medical field. So this is one aspect. The second aspect is when we're giving drugs to the patients, there's some again uncertainties which come in, and this is the story of what happened with painkillers. Painkillers are called NSAIDs, non-steroidal anti-inflammatory drugs. I'm sure all of you have used this, many of these drugs, Combiflam and so on. So when painkillers came, they started using it for all patients, and we found suddenly that some of these people had bleeding in the intestinal tract because of irritation, and then they were stopped. Another group of painkillers called COX-2, which is supposed to be very superior, came. The industry made billions of dollars on this because they were safe, they could stop the pain. Again, many of these are available in the market, and they did not cause GI bleeds. But what came out was there's no bleed. People did not have bleed. But some of these people who started using this developed heart attacks. So many of the countries started banning these painkillers. So therefore, the issue has become, so we have to balance very carefully. We have to know that with the patient with a cardiac problem, we should not give these COX-2 painkillers. With somebody who has a tendency to bleed, we should not give the regular NSAID. So it's a big balance. So we have dilemmas in diagnosis, we have dilemmas in treating these patients. So these are some of the things that we face, which you normally don't actually see. But the other problem is regarding this patent issue. Some new drug comes up in Western country, and this is a drug, for example, which came up recently for hepatitis C virus. Hepatitis C virus is not curable. Patients, 95% of the patients who develop this disease go into cirrhosis of liver cancer, and die. Till 2 years back, a drug was found to cure this virus. It was made by a company called Gilead. And they were selling this, the cost of treatment for 3 months using this drug in Indian rupees was 1 crore rupees. So each capsule was $1,000. So even for United States, it's extremely costly, but the insurance covered this. Some of the countries in Europe became bankrupt because they had to pay insurance to cover this drug. So the reason why you can't lower the price, we ultimately did by some mechanisms, but why you can't lower the price in this situation is because you have these World Trade Organizations, patents and all that, you can't break a patent. But this thing was happening in medicine for a very long time. And the interesting example is forceps. Again, this you know very frequently, that if there's a difficult birth, baby is not coming out, the obstetrician uses a forceps. They'll put a forceps and take out the baby. This is a simple instrument. But this instrument actually was discovered in 1575 by a doctor called Peter Chamberlain. He was actually a French doctor working in United Kingdom. He was not a very popular gynecologist, but he discovered this forceps, suddenly became very popular. And what he did was, he kept it a secret. He never revealed to anybody. But everybody knew that if you had a difficult delivery, you had to go to Peter Chamberlain and it will be successful. So a huge practice, he made a lot of money. This was the first, how they started patents actually. And then he revealed this in 1817 to his grandson. And of course, fortunately, it spread later on to other people. And in fact, he was so famous at that time, and the Queen of England had to have a delivery done. She had to come to his clinic to get it done. Otherwise, everybody had to go to the Queen. It was the only instance that she had to come to. But then, it was limited to a certain group of people, and it became very famous. Then, what happened was, you can see that because this came into use, at that time, before this was being used, 1 in 10 women who had a pregnancy used to die. The commonest cause of death was pregnancy. But this completely came down, and you can see that as this came down further, other methods came. Of course, now it's very rare to die in pregnancy. But children continue to die at that point of time. And the commonest cause of death after pregnancy was being born. Being born and dying immediately. Because 1 in 30 of the children used to die at that time. Till a gynecologist, actually anesthesiologist called Abgar, she was Vincent Abgar who came, who devised a system where children at the time of birth can be actually, you can say, grade them into 1 to 10 based upon like how blue the child is, how pink, whether crying, moving arms, and based on that the treatments change. And now again, very few children die after birth because of Abgar. So these things have made a lot of difference. But unfortunately, for a long time, like I said, this forceps was kept a secret, and benefit didn't come to the medical society. So this is how medicine functions. I just thought I'll give you a little insight of what happens. And this is again a book by Atul Gawande called Complications. This is what happens is, it's a very interesting para he has written. I'll just read it for you, read it along with you. We look for medicine to be an orderly field of knowledge and procedure, but it's not. It's an imperfect science, an enterprise of constantly changing knowledge, uncertain information, fallible individuals. At the same time, lives on line. There is science in what we do, yes, but also habit, intuition, and sometimes plain old guessing. The gap between what we know and what we aim for persists, and this gap complicates everything we do. So we may have all the good intention as doctors to do something, but there's a gap in the science, and this is the cause of some of the complications, some of the iatrogenic deaths. So we really don't want to cause it, but we can. This is another interesting book which actually just was released last month in the United States and it's become very popular. In fact, if you are in US and you switch on a TV channel, you'll have this book there on the channel, and everybody's talking about it. It's called The Nurses. This is written by an author who actually went like a pseudo nurse and spent 1 year with the nurses in a hospital to show their dedication and all that, and then realized that at least in the United States, this is not so often in India, but in the United States, the nurses who are actually running most of the things in the hospital. The doctors are spending just 3 or 4 minutes with the patient. It's the nurse who's there all the time. And what this author found was that in United States, most of the deaths in the hospital are occurring in July. So one of the tips is, if you want to get admitted to hospital in America, don't get admitted in July, because the chance of dying is very high. The reason, then she went to why this is happening, why in July more people are dying, and the reason she found was, in July the nurses were changing their, new ones are coming in, the old ones are going off. July is the area where all the nursing staffs change, and this change was the one which was linked to these deaths, and therefore they play a very important role. So doctors, some role, but I think it's very important that we give credit to these people also. So medicine is not now, and has never been exact science, not like mathematics and physics, 2 + 2 is 4. There's a lot of variability, biological variability, and anything can go wrong, and that's how. In fact, many times we know actually how a patient is dying or how a patient has got a disease, but you don't know why. In fact, I had a bitter experience in early part of my practice. I just finished my DM and came. DM is doctorate, that is we do our medicine MBBS, then do medicine MD, and then do a doctorate, is called DM. So as soon as we finish DM, and this is true for most doctors, as we finish our doctorate in medicine, we are very young, 29, 30 years, we are very arrogant, We think we know everything about medicine because we don't know the fallacies of medicine. We haven't practiced enough. We feel, and people treat us, at least the family treat us like God, that you know everything, and then everybody wants to be checked up. So we are very arrogant. So this is unfortunate, but the first phase, most doctors who are super specialized go through this the first 5 years, and then of course you're knocked to the ground. So this is, in fact, a young lady came to me. She was about 30 years. She had a small baby with us. Baby was about 5 years old, and the baby was very sick. In fact, she already had the diagnosis. The baby was having a liver cancer at the age of, almost dying at the age of 5 years because of hepatitis B infection. Now, she came and put the baby on my lap and said, doctor, can you do anything to save my baby? He just, so I said, see, this is liver cancer, terminal, and in fact, I was actually watching the baby almost die in my arms. She was so sick. So my mother was crying. Mother was asking not how this baby developed this disease, because if it was how, I would have told her very clearly. What happened was, her husband had hepatitis B infection because there was an accident. Blood transfusion was given somewhere, and this blood transfusion gave the virus to him, and he transmitted the virus to the wife, because at that time vaccination was not popular. And when the baby was born itself, the virus went to the baby, and 5 years the baby, charming baby, dying at 5 years because of liver cancer. So if she actually asked me, so she didn't ask me how this baby is dying, because then I would have told her all the theories that I know, because we have studied so much in medicine. But she asked me why, and I couldn't explain why. The why was probably, looking back now, it's the fault of the society and ourselves, because at that time hepatitis B vaccine has already come. If she had been vaccinated, her husband developed, okay, if she had been vaccinated against hepatitis B virus, she wouldn't have got it. If the baby would have been vaccinated, the baby would not have got it. So as a doctor, many times we can't explain why. We can tell you how, but we can't explain why. But when we look back, there are many whys now which can be actually solved. And simple example is hepatitis B vaccine. I don't know how many are vaccinated here, but this is now we recommend routinely that everybody gets a hepatitis B vaccine. 3 doses, it protects you against a disease like this. So this is again, so I think this is one of the things I realized at that time, that a wise man knows that he's a fool, but a fool always thinks he's wise. So all of us who just immediately do our degrees, pass out and all, think we are very wise. We don't realize that we are fools. The other problem in medicine is training. Look at this video. This was a trainee pilot in an Air France flight. He's being trained to fly the flight, and his instructor was not very good, unfortunately. And see what happens to the flight. Of course, there are no passengers, luckily. There are two professions in the world where you can't take a chance even with trainees. One is airline pilots, because they can kill large number of people, especially if the trainee is not properly. The second is doctors. The problem is that there's no learning curve here. As doctors, we do a lot of complex surgeries. There's no learning curve. We have to become good immediately. That's a big dilemma. You can't suddenly become good in a complex surgery if you haven't had training, but you can't afford to have any chance in training. This is a little dilemma. So this is called perfection without practice, which is very difficult. So what we do is we carefully mentor our people. For example, we now have training systems like this, where we have animal tissue or we have computers. We carefully mentor our doctors. We watch them carefully, the junior doctors, and see, is this person capable of doing it safely? We're not worried about whether he's very good or whether he's getting perfect results. What we are worried about in medicine is whether he can do it safely. If a patient comes to us, is the patient safe? And that's how we train our doctors now. Safety is the most important issue, and this is something. So this gets us to the last book by this Dr. Atul Gawande again. This is called the Checklist Manifesto. Now what he did was, he was in Harvard at that time, and Harvard was the best medical school, best hospital in the world. And in Harvard, every year, 464 patients were dying in the operation theater because of mistakes committed by the anesthetist, doctors, instruments, and so on. Just pure mistakes, 460 which means that almost 2 people every day were dying in the theaters. Then he went into this and found simple things like, for example, in the olden days, the anesthesia machine, we used to have knobs to turn the oxygen on, to turn the nitrous oxide on. There was no standardization. If on one machine you turn right, oxygen is to come. In another machine